Hello, we're the Wiggles, and our project is a wearable monitor for children on high-frequency ventilation. Every 2.5 seconds, a child is born that will need assistance to start breathing. But for children whose conditions border on the extreme, traditional ventilation is too risky, necessitating a less strenuous alternative. Intro: High-frequency oscillatory ventilation. HFOV is an alternative to traditional ventilation that utilizes low tidal volumes. When a child is undergoing HFOV, their chest will shake to indicate that their lungs are perfused. But even with the wiggle present, how can we be so sure that they are receiving enough oxygen? Currently, clinicians measure chest wiggle by eye, which is subjective and makes it impossible to evaluate the oscillation frequency with any real precision. Thus, there exists an unmet clinical need for a way to quantify chest oscillations in neonatal patients undergoing HFOV in the ICU. To both identify and validate our unmet clinical need, we spoke to both clinicians and researchers and made several on-site visits, which allowed us to see the ventilators up close. Our ethnography supplied us with the knowledge necessary to start drafting up a few designs. To do so, we first had to discern a minimum viable feature set. For our product to carry out its purpose, what must it be able to do? First, it must be able to detect the frequency of the chest wiggle. To achieve this, we used an accelerometer and hooked it up to a series of LEDs to capture real-time changes in movement in 3 axes, allowing us to reliably measure chest wall oscillations. Second, our device must adhere to the patient. Skin stretching, respiration, and wiggling of the chest should not cause the device to move from its place on the skin. The adhesive in particular comes with many safety concerns. Our initial hazard analysis helps us map out some potential risks. For example, we initially considered the use of a band to mount the sensor to the patient. However, a band could restrict movement of the baby, potentially interfering with the ventilation itself. Furthermore, the band may restrict sensor movement, leading to signal loss and thus inaccurate readings. We then considered the use of a skin-safe adhesive. It's important to note that baby skin is up to 60% thinner than adult skin and has difficulty retaining moisture. Many adhesives pose a serious risk of skin irritation or tearing to babies, which is why we went with a hydrogel adhesive. Hydrogel combats these issues. It effectively molds to the skin and adheres strongly, but remains gentle and even helps skin retain moisture. To test our device, we built a wiggling simulation using solenoids to cause vibrations in a thin foam sheet, shown here. In the future, however, we hope to construct a better simulation by using materials that more effectively mimic a baby's chest and skin. In the spring, we will move forward with V&V testing and continue to refine and iterate our current prototype. We hope to eventually test our product with respiratory therapists and progress further with the development of our product.